بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. أعزائي طلاب وطالبات المستوى الرابع برنامج بكالوريوس طب وجراحة الفم والأسنان جامعة العلوم والتكنولوجيا، أهلا وسهلا ومرحبا بكم في مستهل سلسلة من اللقاءات التعليمية المتعلقة بمادة أو مقرر طب الفم. في ضمن هذه اللقاءات أو السلسلة التعليمية سنتحدث عن مجموع محاضرات منهج مقرر طب الفم لطلبة وطلاب وطالبات مستوى الرابع لبرنامج بكالوريوس طب وجراحة الفم والأسنان. The course description of this course will talk about the risk factors, diagnosis, treatment, as well as the prognosis and the pathogenesis and the causes of oral and para-oral diseases. In this course, we will talk about also the basic knowledge and the skills that are involved in the diagnostic process and treatment planning of each disease related to oral and para-oral tissues as well. This course also will allow the student to effectively communicate with her or his patient to establish the sound patient-dentist relationship. So, carrying out general and detailed examination of extraoral and intraoral structures. In this course also, this course offered to through video lectures as well as provided in LMS and assisted with clinical practice sessions in the dental college. The video lectures will cover various topics, interviewing process and clinical methods and oral white and red lesions, as well as will explain the vasculobolus lesions, ulcerative lesions, pigmented lesions in the oral tissues, and also will talk about 3 or 2 lectures in oral cancer, as well as the orofacial pain, salivary gland diseases, and on relevant aspects of the diagnostic tools related to treatment planning and diagnosis those lesions. In the practical session, the dental student will be the course intended to learn the students how to examine the diagnosis, examine the patient and reach the final diagnosis, and also make a differential diagnosis of different lesions, reaching the final diagnosis associated with the various oral lesions. The oral diagnostic science and the subjects which studied in the level 2 and level 3, such as microbiology, oral histopathology, oral head and neck anatomy, these microbiology, all these subjects should be reviewed correctly, and the students should be revised, those students, to introduce this course. At the first lecture, we will talk about introduction regarding the history and presenting complaint of your patient. The references of the first lecture will the oral and maxillofacial medicine, the basis, diagnosis and treatment of Dr. Crispian Scully, the second edition, as well as the second textbook of this lecture is the handbook of oral medicine. In addition to textbook of oral medicine, the second edition, as well as the oral medicine and pathology at a glance for Professor Crispian Scully. The aims of this lecture, the student at the end of this lecture should be able to know the aim of the oral medicine in general, and the student should be able to know the principles of the patient management and should take the comprehensive patient history, introducing his chief complaint and history, and the patient should be, the student also should be able to describe the concept and the types of diagnosis. So at the end of the first lectures, the all mentioned aims should be provided or presented in the student mind. In this lecture, we will talk about definition of the oral medicine in detail, and then we will move to fundamental principles of patient management. What are the principles to manage your patient, and the patient assessment and history taking, starting from history of present complaint, continuing to the social history. We have 7 types of history should be taken from your patient before you start to make a differential diagnosis. And also we'll talk about the purpose of making diagnosis, why we make a final diagnosis before starting your treatment, and what are the types of diagnosis. So we have many types of diagnosis. We will emphasize in the most important types of diagnosis which related to your final decision making and treatment planning regarding the case of your patient in your clinical session or in the future in your special clinic.
Oral medicine include the diagnosis and medical management of disease of specific orofacial tissues and also oral manifestations of systemic diseases. So diagnosis and medical management. So we will start with the diagnosis of the patient. We must not hurry to treat the patient without perfect and definite knowledge of the definite diagnosis of the patient. So we must reach the final definite diagnosis, and then we should move to the second step of the patient management, medically or dentally or whatever. Of diseases of specific orofacial tissue, the diseases of the oral medicine might be specific to the orofacial tissue, or it can be as an oral manifestations of systemic conditions. The lesions of the patient might be a diseases start in the orofacial tissue without any connection with other systemic condition, or it might be as an oral manifestation of systemic diseases. So as we see in this tree, the oral medicine included oral diagnosis, then examination of the patient, physical and medical evaluation. So the oral cavity is a part of the body, so we must diagnose the patient as a patient, not as an oral lesion or a dental complaint. Then we might need to do an investigations, management of orofacial diseases, oral therapeutics. We have an overview about oral therapeutics that related to the oral cavity, cancer detection and prevention. We are in a community which have a common bad habits that related to cancer. We will talk about oral cancer in about 3 lectures. Dental management of medically compromised patient. Those specific group of patient, we must know how to deal with those patients. So the fundamental principles of patient management, as we said before, the diagnosis, then treatment. So we'll start with diagnosis. Diagnosis is a process including processes starting with dental history, medical history, family history. We'll talk in detail about the history of the patient. Then we will move to the second step, which is the examination of the patient. After we take the comprehensive history of the patient and do an overall examination of the patient, we will might need to do an investigations to reach the final diagnosis. The final diagnosis can be reached just from the history of the patient. In other lesions, in other circumstances, we need to do an examination to check out the clinical findings of that complaint. In some lesions, we need to perform an investigations to reach the final diagnosis and differentiate the final diagnosis from the other similarities. After we reaching the final diagnosis, we will move to the treatment. So the treatment must depend on the final finding or the final diagnosis. Patient history and assessment. It's very important to take a comprehensive patient history and assessment for the patient regarding reaching the final diagnosis and the final treatment plan. So the patient history is very important part for initial communication between the dentist and the patient, as well as it is very important to adopt a professional appearance for the dentist and the manner. Taking the history from the patient including introducing the dentist on self or the patient. What is your name? Clearly, what is your specialty? As well as best given in the patient's own words. When we take the history from the patient, it's very important to take it by the patient's own words. Just take a free area to the patient to express the complaint and his history. This will help you in the final diagnosis. We have the specially designed case sheet for oral medicine. As you are a dental student at the level 4, you have a case sheet for oral surgery, case sheet for operative dentistry, case sheet for prosthetic dentistry, and this is a specialized case sheet for the oral medicine subject. The case sheet including information about the demographic data of the patient, about the history of the patient, about the clinical examination and the habits, and reaching the differential diagnosis and the final diagnosis. It's important to cover the following in the case sheet. General demographic data and information of the patient, including the patient's name, including the patient's occupation, including the sex, gender of the patient, marital status, and also the age of the patient. So every information in the case sheet regarding the demographic data is very important, helping you in reaching the final diagnosis. So many of the complaint of the systemic diseases or the oral lesions are associated with the age, associated with the occupation of the patient. For example, when the patient is working in a factory dealing with heavy metals, the pigmentation in the oral cavity or other complaint may regarding or related to the cytotoxicity or toxicity with the heavy metals. When the patient work as a nurse, so it is exposed to the infection by hepatitis B or any other virus. Present complaint of the patient. What is the present complaint of the patient? And also the history of the present complaint, past medical history, dental history, as well as family history and the social history. Social history including the habits of the patients, card chewing, smoking, and also the snuff using. Most of these habits are related to oral cancer and other oral agents. The first part of the case sheet, specially designed case sheet, including student's name, you must write your name here, and the date of presentation of your case. Then the first part is the general information or the demographic data of the patient, including the patient name as we mentioned before, the name and the date of birth, gender, ethnic group, place of residence, occupation. The second part, the present complaint most countered in dental practice are pain. The patient came to you complaining from pain, complaining from red or white or other pigmentation in the buccal mucosa or tongue, lumps and swelling, soreness and ulcers, cervical lymph adenopathy, dry mouth, halitosis, as well as sensory and motor changes. The patient might complain from paresthesia or permanent anesthesia in the lower lip. The patient might complain of bad oral hygiene leading to bad oral odor. So we call it a halitosis. Then the history of the present complaint. What is the characters of the present complaint of the patient? When this present complaint started and where it's located. It's in the buccal mucosa, in the floor of the mouth, in the orifices of the salivary gland ducts, as well as what are the aggravating and relieving factor. Aggravating factors, the factors that increasing the severity of the pain or the swelling or whatever, and the relieving factor, what are the factors that reducing the severity of the pain. What are the investigations thus far? Did the patient had any investigations before he came to you? What are the results of these investigations? Then what are the treatment already received? So we will evaluate the effectiveness of this treatment. In taking the history about the present complaint of the patient, it's important to ask the patient an open questions. Open questions mean that you ask the patient and take an free area to express the complaint of the patient, not asking him as a yes or no questions, what we called it a leading questions. Then it is very important to do a past or relevant medical history evaluation of the patient, what we called it a review of systems. Review of systems means that you must ask the patient everything about any symptoms or signs or any history related to other systems of the patient, starting from the endocrinal system, respiratory system, digestive system, reproductive system, skin diseases, nervous diseases or nervous system, cardiovascular system, review of human body. So the patient came to you as a whole patient, so you must to deal with the patient as a complete human body, not just run to the oral cavity, examine the oral cavity, treating the oral cavity lesion without any correlation between systemic condition. As we mentioned before, the oral lesions might be, or the oral medicine or the oral pathology might be a persistent oral lesion separated as an oral lesion, or it might be an oral manifestation of systemic diseases, oral manifestation of systemic disease. So you have to do a review of system of the body to find if there is any correlation between the systemic condition of the patient and the oral findings. So you can find fever of the patient and also you can find weight loss. Weight loss might indicate many of systemic conditions like diabetes mellitus, like cancer, like thyrotoxicosis. All these systemic conditions might lead to weight loss. So if you find any lesion in the oral cavity, you might correlate this lesion with the other systematic symptoms. Relevant symptoms related to body systems, nervous system for example, respiratory system as we mentioned before, and also the skin lesions. For example of skin lesions that might present as a systemic conditions is Addison disease. Addison disease is a systemic condition presented as a diffuse pigmentation in the skin and the oral cavity, oral mucosa. Medical and surgical consultations, investigations and treatments including radiotherapy. Radiotherapy might presented or complicated as in the oral cavity as a mucositis. So the patient came to you complaining from ulcers, difficulty of swallowing. So it is very important to take a comprehensive history related to the medical condition of the patient. Also in the medical history part, it's important to include the current prescribed drugs, previous illness of the patient, hospitalization, operations, as well as allergies. Current prescribed drugs, many of the oral lesions might be side effects of currently prescribed or taken drugs, like dry mouth, like halitosis, like ulcers, bleeding tendency. Also you might need to do a biopsy for the patient. Biopsy means it is a surgical procedure leading to continuous bleeding if the patient complaining from bleeding tendency, as well as drug therapy if the patient is under anticoagulant, such as the patient under hemodialysis, and patient under corticosteroids. Endocrinal disorders, especially diabetes, also should be taken into consideration. Infectious diseases, to protect yourself, to protect the patient, to manage the patient effectively and protect your team. The number 5 part in the case sheet is about the dental history. Dental history, you should give an idea of the regularity of the attendance of your patient to the dental clinic, attitude of your patient to the dental treatment, recent relevant dental problem. What are the recent dental problem, as well as the recent restorative treatment. So you can find a white lesion related to lichenoid reaction, for example, as an allergic reaction or autoimmune for the new restorative material. Family history. It is also very important to take the family history. So many diseases are hereditary from the parents to the second generations, as well as the social history. Our community is or has very common bad habits like cat chewing, snuff using, and smoking. So these bad habits are not related to the present complaint of the patient. For example, emphasizing the importance of taking the history, which helping you greatly in reaching the final diagnosis, is the antibioma. Antibioma is a lesion that related to misuse of or caused by misuse of antibiotics. If you just examine the patient and do any investigations for the patient without taking the comprehensive history from the patient, you might diagnose this hard bony swelling in the patient as a bony swelling, odontoma, or other bone lesion. But when taking a comprehensive detailed history of the patient, we know that this patient had a misuse of antibiotic. He was complaining from odontogenic infection of lower 6, and he take undescribed or unprescribed antibiotic. He doesn't complete the dose. He doesn't take the suitable dose of antibiotic. So this what is called antibiotic misuse may lead to antibioma. So after taking the history of the patient and doing the investigations, we should reach to the diagnosis. What is the diagnosis means? Diagnosis means thorough knowledge of data about the patient and their complaint using senses. So you will listen to the patient when he speak his history. You will observe the patient to assess the appearance and the behavior of the patient, and also you will touch the lesion to examine if there is any induration or temperature. Induration means that if you have an exophytic lesion, you should palpate the lesion to find if there is any induration, if any dimension of depth for this lesion, as well as you will smell if there is any malodor or halitosis. Why we make a diagnosis? To be able to offer the most effective and also the most safe treatment, and also to perform an accurate prognostication, so the patient will know what is the outcome of your treatment. Prognosis. Types of diagnosis. There are many types of diagnosis, and it is important to know each type of these types. Clinical diagnosis made from the history and clinical examination. Pathological diagnosis provided from the pathology results. So when you have a lesion, you will take a biopsy from this lesion and send it to the histopathologist. So the histopathologist will diagnose the lesion. What we called it a pathological diagnosis. Number 3 of the types of the diagnosis is the direct diagnosis. Direct diagnosis is made by observing the pathognomic features. Pathognomic features means that this feature is related only to one lesion. For example of pathognomonic feature is the skin target lesion. Skin target lesions are a concentric erythematous lesions which might present in the skin or the oral mucosa. Skin target lesion is commonly associated with the patients with erythema multiforme. So it is a pathognomic feature for erythema multiforme. Number 4 is a professional diagnosis. The more usually made diagnosis. This is an initial diagnosis from which other differential or other investigations can be planned or made. Number 5 of the types of the diagnosis is what we called it deductive diagnosis. Deductive diagnosis made after due all considerations of the all facts regarding the history, examination and investigation. The more important type of diagnosis is also what we called it differential diagnosis. It's very important type of diagnosis, which is the process of making diagnosis by considering the similarities of those lesions and differences between those similar conditions. So the differential diagnosis, making the similarities with each other and reaching the final diagnosis or the definite diagnosis by excluding the other findings. For example, if the patient had an ulcer, this ulcer might be traumatic ulcer or aphthous ulcer or ulcer related to systemic condition, basic disease or whatever. So this is the differential diagnosis of oral ulcer, for example. By exclusion and by investigations we will reach to the final definite diagnosis. This is what we called it a differential diagnosis. So making together all the similarities, all the lesions that has the similar clinical findings, similar symptoms. Then diagnosis by exclusion is a type of diagnosis by identification of disease by excluding all other possible causes. The other type of diagnosis is diagnosis exjuvantivus, which made on the results of response to treatment. So we will start the treatment of the patient to confirm our diagnosis. For example, the treatment of neuralgia. Trigeminal neuralgia is a severe pain, electric shock pain, can be diagnosed by the response of the patient by the treatment, what we call the Tegretol or carbamazepine. The other opposite diagnosis is the provocative diagnosis, by which we will do an induction of the condition to establish the diagnosis. For example of the differential diagnosis is the differential diagnosis of halitosis. Halitosis can be related to oral disease or related to volatile foodstuffs or drugs or related to tobacco use. The patient who is a smoker, there is halitosis or bad odor released from his mouth. And also it might be related to metabolic diseases, liver disease or renal failure or diabetic ketoacidosis. Psychogenic means that the patient had not any halitosis, but he thinks that there is a bad odor released from his mouth or her mouth. Respiratory tract diseases, infections and foreign bodies and tumors. This is an examples for respiratory tract diseases that may lead to oral halitosis. The other example of differential diagnosis is the differential diagnosis of facial swelling. Facial swelling might be due to inflammation or infection, might be due to trauma, might be due to post-operative emphysema. Insect bites also can be presented as a facial swelling. Angioedema also can be presented as a facial swelling. Endocrinal metabolic causes such as the patients who is under corticosteroids, which lead to retention of fluids. leading to facial swelling. Cysts also can be presented as a facial swelling. Neoplasm, like benign or malignant tumors. Hemangioma, lymphangioma, foreign bodies, and granulomatous diseases also, all these diseases can be presented as a facial swelling. So this is the similarities that presented as a facial swelling. In conclusion, we had taken in this lecture the definition of the oral medicine, and also we had explained the fundamental principles of patient management, starting from taking the history of the patient, reaching the diagnosis, and then followed by the treatment of the patient. Then we had taken the patient assessment and history taking in detail, including the types of history, starting from the history of the present complaint of the patient, reaching the social history. And also the purpose of making diagnosis. Why we make a diagnosis? We say that we make the diagnosis to get or to reach the most effective and the most safe treatment for the patient, and also to get the prognosis. Finally, we had talking about the types of diagnosis, emphasizing on the differential diagnosis. The assessment of the first lecture in oral medicine course is the patient must fill the case sheet, the presented case sheet for any patient, gaining all informations required, and also this assignment will be provided in the assignment section of this course as an attached Word document. The full form of case sheet will be presented in the website, in the LMS, also as a paper based in the library. The student must fill the case sheet for the patients in a comprehensive way. This will be presented as an assignment 1. Thank you very much for your listening.